find a new meaning in nursing. Her first company, Royal Nursing Consults, was established in 2011 in Abuja. It is poised to make nursing and nurses become more relevant in the scheme of affairs in Nigeria. Julie's passion and nursing profession are almost inseparable. Little wonder you hear her often say, "My passion fuels my profession." Julie is currently based in Abuja with her family, featuring at the Emergence Summit 2022. Julie Mogbo. Julie Mogbo is world's first.
Greetings everyone. How are you doing? Well done, my daughter.
We're doing all great. Good evening to you. Wow, you're looking so beautiful and awesome tonight. Wow, God the creator.
Thank you, everyone. I want to say very well done to everyone for being a part of this. I know it's been a long day for a number of us, and for those that are behind the program, behind the camera, well done. You're doing a great job, Max Walter. You are doing great moderating the whole session. And to Mr. Princewell, like I do, and the entire team, I want to congratulate you on the successful organization of this particular Emergence Summit. It is indeed my pleasure to be here as one of the featured speakers at this event. My name is Julie Mogbo, and the voice there made some pronunciation error, which is understandable. Hopefully in the course of my presentation, I will be able to give this better pronunciation of the introduction. So I took time to listen to a few of the speakers, and they have done excellently well in delivering on the topic. Those who touched basically on the aspect I'm going to build on that I listened to are Adenike and Mr. Melvis, and they did a great job. If you did not keep down notes, I hope you'll be able to have access to the video. For those who paid, I don't know what the organizers are planning, but it's always good that nurses try to take down notes when events like this are ongoing. I really would want to present this live. I'm not using slides, so you're going to watch me. I know it's been a long day for everyone. I want you being on this call to just show some fire, use some emojis, say something. Let's see that you're still here. We still have energy in the house, because you need some energy to go to bed with, for those that have beds to join after this. But those that are still going to work, you still need some energy to work. So I want to see some fire in the chat box. So if you're happy to be here, to be a part of this summit, then let us see you show it with some fire. Great. I'm seeing Galaxy Notes and some other people. Awesome. Awesome. Dr. Kelechi did a very wonderful work delivering on technology. I'm glad that this was a part of the program. It is something that nurses actually need to latch on to. So very well, I wouldn't go into the definition of personal branding. I just want to say how you can use this to advance in your career. And when I say career, we're talking about nurses. So I'm pretty much going to share a bit of my journey and give a few tips on how we can use personal branding to advance, to make progress, to enhance our career, to enhance nursing. So I usually would say that nursing found me. Why am I saying this? I've had opportunity to speak with nurses. I have heard nurses complain about nursing profession and almost everything that has to do with nursing profession. I've seen nurses migrate from Nigeria to other clients, and they badmouth nursing in Nigeria and the Nigerian government. I really want to thank Prince, like I do. I saw one of his posts that he said that this is not the right approach to it. And many nurses do not know. So I tell people, you don't go and turn your back on your country. They are watching, people are watching. When you open your mouth to say something, you're telling the world the kind of person that you are. So when we talk about personal branding, let me put it in very simple terms. It's basically packaging. Let me use that word. Personal branding, it is packaging. How well are you able to package yourself within your space in the nursing profession? You heard Melvis talk about he knew he had to dress well, he had to buy cars, he had to do certain things. That is packaging. You see Adenike speaking, you see Prince Lagedo's pictures and all that. It's not because he just wants to show off that he has money or he can buy suits. No. It is called packaging. You will dress like the part you want to play. You will dress like the future you want to experience. So I'm basically going to talk about 3 points. One is A, the second is B, the third is C. So I'm not going to be defining personal branding because that has been talked about. But in the course of my presentation, I'm going to be doing some more. So A, B, C. I want somebody to note that down. Please put that in the chat box if you can. If you can, A, B, C. Those 3 points I'm going to start with. So A is for appearance. How would you use personal branding? All that Adenike has said, all that Tumelis has said, how do you use personal branding to advance in your career? So the first thing you have to do is to appear. Now, I am not bothered about the fact that this is, by my own time, about 9 o'clock in Abuja, Nigeria. And after now, I am going to be driving home to bed. I'm having another virtual meeting, but this is how I show. This is how I appear. My personal assistant is currently in the UK. I didn't even know she's been observing me after when we had spoken. She appeared on a Zoom call when she had the opportunity to speak to my community. And she told them something, an observation that her team and her superior made in the UK. And they said, you always show up at your best. And she attributed that to having learned from me, that she realized, especially during the COVID time, when we were having meetings in the night, she said GP would always show up. So can you hear me? I read someone say the audio. Does someone have to mute their audio?
Yeah, please, if your microphone is currently unmuted, please kindly mute it and let the speaker talk, okay? So please, if you're not speaking right now, kindly mute your microphones. Thank you.
Thank you, Matt. I hope the interference is taken care of.
It's a lot
Great.
better now.
Okay, so the first thing is to appear in your profession, wherever it is you find yourself. Many nurses are saying to run from things. They don't want to appear. I came into the nursing profession in 2005, and I started hearing, I came at the time where nurses don't appear on the media. Nurses don't speak on radio. So I came in, I was already doing these things before I came into nursing. So when I hear, oh, no, nurses don't do this, nurses don't do that, I said, if nothing is going to stop me from being me, then I would rather switch lanes. But then I came in and had to make inquiries to find out why is it that nurses don't appear on media. But of course, I had to break the jinx. And thankfully, I was able to connect with a few other nurses who had similar passion. And we started appearing on television, speaking as nurses. There was a time where we will be called on for interviews, and we are asked, okay, we want a medical doctor to speak on this topic. And then I tell them, I am not a medical doctor. Okay, so can you speak on this particular topic? I said, of course I can. We did that the first time, and then a call comes because we are used to hearing, we want a doctor, we want a doctor, we want a doctor. So I got the call another time and I said, hey, you're speaking to a registered nurse. Then the media person, the journalist says, what does it matter? I said, okay, so now you're coming to terms with the fact that nurses know beyond the needle. So that was how we started in 2016, started appearing on international television. I'm talking about appearing. So whether you are on the clinical side or you are in school, wherever it is you find yourself, nurses, you are the light, and that light must shine. You have what it takes to change and transform the healthcare industry. But if you do not light your lamp, there is no way people would even know that you are one. If you do not light your lamp and place it on a lampstand for others to see, there is no way you're going to enlighten people about you, about your functions, about your contributions, about your capabilities. There is no way. Nurses are demanding for better pay. Nurses are demanding for respect. Nurses are demanding for a lot of attention. But who will? Mavis just gave it right. He took out some words out of my mouth where nurses, let us accept it, that when it comes to the healthcare space, you are considered a second citizen. Maybe not even a second, maybe a third or a fourth. And there's no need to apologize about it. Unfortunately, that is what we have made of ourselves, where they would consider a doctor and probably look at a pharmacist and look at a lab scientist before they consider the nurse. So I registered my first company, limited liability company, in 2011. And why did I do that? I saw that there's a lot that nurses do, which I discovered from school. And when I'm having conversations with people, I had doctors try to convince me to go study medicine after nursing school. They said, oh, Julia, you're too intelligent to be a medical doctor. And I'm like, don't you think that I will be deviating? I came into nursing purposefully. So that'll be a deviation from my call. So we registered that company. We started having calls for nurses to take care of people. And then when we give a charge, I used to do that first of all. I was one company, so I would go work in homes and take care of people in the hospital. And then when I give a charge and they're like, is it not to do vital signs? Hey guys, let me shock you. At the highest level, healthcare level, what they think nurses do, nurses go to school to study, is vital signs. Why? Last year, I was invited to be on a stakeholders meeting where we had professionals across field, and we're discussing regional matters. So when I say regional, we're talking about Africa, how to strengthen our trade, how to make our country more enticing to foreigners, whether it's in the healthcare space, technological space, in the maritime space, in the engineering space. So we had stakeholders coming. So I came under nursing, under healthcare. I got that call. I wasn't part of the organization. It's breaking again. I wasn't part of the organization. I was just on my bed when I got the call. Julie, I am Dr. XYZ. I need you to be in Lagos at the stakeholders meeting. And I had to get up. I had to make it, because if I did not go, there would not have been a nurse at that meeting of that caliber. So when we went there, we were discussing. I started highlighting, so they put the doctor, what his roles were, and then they put the nurse, and in bracket, in fact, they didn't put the nurse first. So what they put first was vital signs, bracket, nurses. And then I smiled. So I started educating them what nurses actually do. So that is for us to know that if you do not appear where it matters, whatever it is thrown at your table as a nurse, you take it, because you have given them the permission to treat you that way. So if you do not like the way you're being treated, then you have to show up. Then you have to appear. It is very important. So I came into nursing with the thought to strengthen relationships. I came into nursing and discovered that there was a gap in family health. So I decided to start researching to find out. I said, if we did not have family nursing, I was going to create one. That was right from school, talking about 2005, 2006. So I went on the mission to start discovering about family nursing and all that. I started looking for mentors. I needed nurses who were qualified, that were doing things to learn from. And I did not find, but thankfully, I found an American nurse. And I have introduced her, connected a number of Nigerian nurses to her. I said, you just go follow this nurse. And I will mention her again for those who do not know. That's Donna Cadillo. Why am I mentioning Donna Cadillo? Donna Cadillo was one woman I followed from afar for 8 years. While as a nursing student, when I graduated and when I started doing some work, for 8 solid years, I kept on following Donna Cadillo. And I learned a lot from her, from afar. I never contacted her. I never sent her a message, but I would like her post. I would comment under her post. I would read her newsletters. I was following. Not until one day, Donna sends me a message. And I'll tell you, she sends me a message and says she wants to feature me in her work. Appear. How are the ways you can appear? Show up in your school, show up in your workplace, where things are being talked about, show up. Then one thing that the world has given us today is technology, is the social media. Show up on social media. While I was doing my work as a nurse, I started coining myself, introducing myself as a family nurse. Simple, I care for families. The care that I render, I don't manage my patients in isolation. For the records, I am not a clinical nurse. I work directly with homes. I work directly with families in their homes, or whether it's in the hospital, I am called in. I get into the hospital. I involve the family in the cause of the care of patients. I have been able to work myself to a point where I may not work in a hospital, but I will be invited into the hospital. So appear on social media. While I was talking about things around family nursing, family health, then on Twitter, somebody sent me a message and said her colleague said that there's a nurse in Nigeria that calls herself the family nurse, and she thought to chat me. And then said that, how did you come about these names? I see the things that you are writing. I see the words you're using. How did you come about family nursing? I decided to share my story, how I came into nursing and why I am focusing on family nursing. And she encouraged me to join the organization, the association, the International Family Nursing Association, of which I'm a pioneer country representative. And then encouraged me to be at the conference at the time. But of course, I couldn't go. To get a US visa, even at that time, was difficult. No thanks to Trump. I couldn't go. And then, of course, I was having I think it was my second baby. So I couldn't make it to the conference. But then she then tells me that, Julie, do I have your permission to share your story at the conference? And I said, of course, go tell my story. And she was glad she shared that story at the conference. Appear in school, appear on the words, appear in the society, appear on social media. Then the second one is B. B is behave. We've had this word being flogged over and over again about nurses' attitude, nurses' attitude, nurses' attitude. We know if you want to become something, if you have a vision, a desire to become something, begin from now, regardless of the environment, to behave like that thing, become that thing. When I stepped my foot on the soil of School of Nursing, many people didn't know I went through School of Nursing. So when I speak sometimes, they say, Julie, you're very lucky. It wasn't the same system that trained you. If you passed through School of Nursing, oh, you would not be saying and you would not be talking like this. And I smiled. I said, let me shock you. I went through School of Nursing. When I stepped my foot on the soil of the school, I told myself that nursing will not make me what I am not. We bring our being, our personality into nursing. Nursing is a victim of nurses. Nursing as a profession is very innocent. Nursing is like water. Nurses are the containers. So we are the ones shaping nursing. We are the one bringing our personality to put a shape to nursing profession. So nursing takes our shape. Nursing is taking your shape. Nursing is taking Principal Agedo's shape. Nursing is taking Max Walter's shape. Nursing is taking Melville's shape. So whatever, nursing is like water. Give it a shape. Give it a container. We are the containers. Nursing is like a spirit, and we are the bodies. Nursing is like a spirit, and we are the bodies. So you have to behave. You cannot give what you do not have. Our behavior comes from within. Many a times we blame our employers, we blame the government, we blame the patients who do not value nurses. But what we do not realize that whatever it is that we express comes from within. And how does that happen? We either have told ourselves that, oh, patients don't respect us, they are looking down on us. Who told you that? Have you established a relationship with the patient? Have you opened your mouth and treated the patient with respect? Have you demonstrated knowledge? Have you showed that you genuinely care for a patient and the patient still does not respect you? That's a valid question to ask. You get out of life what you demand from life. So what are you asking life? If you're asking life for respect, then it means that you on your own will show respect to people. I have never had a cause where I got insulted by a patient, and I've been practicing for like 15 years. I've had encounter at different levels. I've been on the customer service level where I interact with patients, I interact with patient relatives, community people at different levels. I do not remember where I felt insulted. Not that someone has not tried to insult, they will say their words, and my response, totally different. Where a nurse understands her worth, then nobody can mistreat you. I give you a practical example. So at a point, I was a pioneer nurse in a school. I chose to work in a school after I graduated. That's because it afforded me the family environment where I wanted to serve. I am family, anything family, you have me there. So there was a particular student I was supposed to give a medication eye drop, and then somehow I missed it because I had a first flight to catch the following day after school, and something happened. I could not secure the ticket on time, so it delayed me returning to work. The mother of this child came, just to cut the story short. After all effort to reach her proved abortive, she came on resumption day with fire in her mouth, came to me and then said, "You call yourself a nurse?" She was raining brimstone and fire on my head. I anticipated it. I stayed calm. So I told her, I said, "Ma'am, I remained in school that day up until 7 p.m., despite the fact that I had a 7 a.m. flight the following day. I gave you 40 missed calls and I didn't get a response. I sent you 7 text messages, ma'am, I did not get a response. At the time we discovered we had missed her drug, it was only less than an hour. She could still have taken the antibiotics." I then had to report to the head of school. "Yes, you had to report to the head of school. That's because you knew that I was going to do this and do that." I just smiled. I told her, I said, "Ma'am, I am a professional. I have a license to practice. And my license tells me that whenever I commit an error, I have a responsibility to report to my direct supervisor. I just did what my license demanded of me to do." The woman kept quiet and she walked away. This was the same woman who threatened the staff in that school, saying that she was going to make the staff's life miserable in the town. She kept quiet and she walked away. Know your worth. Behave. Do not let any patient make you lose it. When you behave, your authority, your employer, the HR, your supervisor is seeing you. I will not tell you what I haven't tried, what I haven't tested, what hasn't worked for me. So now let's move to C. C is communicate. Communicate. So when we talk about communication, it's a challenge for many nurses. I have been in the space of training of nurses, and the last project I handled was in a massive multi-specialty hospital where we coached about over 160 nurses. Nurses and communication, we need to undergo training for communication, and that's a fact. The minute you open your mouth as a nurse, you tell the world who you are. The minute you open your mouth as a nurse, you tell the world who you are. So no matter what you say, you cannot go and change, "Oh, I actually didn't mean that." So do not say what you don't mean. Say exactly what you mean. When you open your mouth to speak to the world, you tell the world who you are by your words. There's a way you manage patients. There's a way you manage their relationship. There's a way you manage their expectations. There's a feedback. There's a way you speak. If anything has helped me, I would tell you, one of the secrets that has helped me is communication. It's the ability to infuse emotional intelligence, to weave it in your sentences when you speak. Max Walter will bear with me witness because we exchanged some chats. We exchanged some chats this night while I was waiting for my call. So it is important for you to communicate effectively. When I made up my mind that I was going to matter. If you want to be a floating nurse, you just want to pass by. Oh, it's okay, but do not envy those who are making it. You've chosen your path. If you want to make it, if you want your name to be mentioned, if you want to increase your value, your economic value, then you have to abide by the rules, by the principles of engagement, by the principles of leadership, by the principles of professionalism. You need to know them, you need to act, you need to abide by them. So I've talked about A, appear, B, behave, C, communicate. And then how do you put these things to use? One, you position yourself when you appear. You position yourself when you speak. You're positioning yourself when you behave. Positioning is key to advancing in your career. When there's an opportunity to serve, take it, show up. Who can do this for us? I will. I really do not know how it's done, but I'm ready to learn. Show up. And when you're showing up, show up at 100%. There was a program that we organized at the time. We were careful about making it excellent driven, all through from start to finish, from registration stand to the food that we served. A particular nurse actually showed up, came up on time. I was walking into the hall and then I saw her stepping out. I said, ma'am, the program is about to start. Where are you going? She said, I am not properly dressed for this occasion. I smiled and I said, ma'am, you took a wise decision. We'll be expecting you back. Nurses dress well.
Just go there. Either you call the number or when you get there.
Key are the two. Appearing, behaving, communicating would help you position. When you communicate, when you say something, when you make contributions while discussions are going, nurses, please don't keep quiet when there are stakeholders meetings going on in your office. Where there are meetings, said, is there a nurse? Isn't a nurse supposed to be at this meeting? Speak up. Speak up. When you speak, you're telling people, oh, okay, she can. Oh, she can handle it. Oh, the nurse that spoke. Let me give you another example about speaking up. I attended my daughter's, when I resigned from my job in Lagos and returned to Abuja. My first assignment was to attend PTA meeting. I attended and they just announced they were going to increase the fees by 38%. I knew that there was nothing that parents would say will make them to rethink their decision. So I decided to just keep quiet. My daughter came to me and then said, Mommy, say something. Mommy, say something. Every other parent is talking. It was God that sent that girl. Let me be very honest. God sent her. I said, what am I going to say? They're still going to increase. He said, no, Mommy, say something. So I got up and I spoke. I said, my father took responsibility to send us to schools that matter. And I want to send my daughter to a very good school. I went to almost 10 schools before I stopped at this particular one. So if you're increasing the fees, just give us value for our money. Then before I sat down, without thinking it, I said, anyway, by the way, I am a registered nurse in case you need my services. And then I sat down. I never knew that the person that was seated by me was the Controller General of Fire Service at the time. This man gets up. He wasn't in his uniform. He gets up and then he takes my number and says, my brother is opening a very big school in Abuja. When it's in a year's time, when it's ready, I'll call you. And then he was leaving. Oddly, people were waking, they're standing up, open the door. And then the man, I said, who is this man? I didn't know who he was. I didn't have his number. He took mine. He said in a year's time, he would call me. A few days after that particular meeting, I received a call. He said, I'm calling from this school. Your daughter gave us your number. My brother just opened up a big school in Abuja, and we would like you to come in and see if it is a job you would like to take. Honestly, I thought it was that man. It wasn't. But I went to this school in Maitama. I have always wanted to work in a school. And that immediately I got into the environment, I took the job before I knew what the salary was. I was like, I am going to take it. I really haven't written any application letter. I have always been recommended for jobs. It was when I was going for my interview, I said, hey, please, when you're going, so that we just have your records, take your CV along. But that job already was a done deal. I started on a salary of 150. In fact, the position was for his 250. Imagine if I didn't show up. As a mother, responsibility. I said, well, I'm tired. Imagine if I did not speak. Imagine if I did not speak, that opportunity would have left me. Till date, I don't have a resignation letter in my file. I have absence of, I don't know how, 8 years gone, more than how many years now, about 9 years. They said leave of absence. They said, you're not resigning. When I was getting married and I was moving, they wanted to get my husband a job to bring him into Abuja. But I had to leave. They said, don't resign, just sign at leave of absence. Till date, go to that school in my file, leave of absence. Communicate, show up, behave, appear, behave, and communicate. It's important. Then the other thing is networking. Nurses, please, when you go to event, please do not just sit down. You dine with the same person, you study with the same person, you come to an event, you sit with the same person again. Break away from the norm. Network, you never can tell. Network with other people. You never can tell where that will take you to. And then build relationships. I'm not going to dwell more on this because I think I met Oluwatobi of NGO talk about building relationships. You need to establish relationships outside of your network. These are important. The drivers are appear, behave, communicate. Because people are going to look at how you appear, they're going to look at how you're behaving, they're going to look at how you're communicating. I've seen a number of nurses send DM telling me that they need jobs. And sorry, I do not give jobs. If I haven't worked with you, if you have not undergone any of my programs or trainings, I cannot recommend any nurse. I can recommend Oluwatobi for a project, for a contract, for a deal. I can recommend Prince Will for a whatever big deal. There's something that I know is his expertise. One hand, I'm calling Prince Will, can you handle this job? But a nurse that I don't know, I can't. I can't. The one time I said I was going to do it like 3 weeks ago, the nurse messed up. So it's important for us to always appear, to behave, and to communicate. And then now the last thing I'm going to say before we go is ask yourself, what value am I bringing into nursing? What value? What is my content? What message do I have of nursing? Find that message. Time would fail me to break how you can find that message. Perhaps I should very quickly say, so when I do family nursing, it is still broad. So I tell people that I work primarily with childbearing families. So I go through the overhaul of teaching them how to strengthen their relationships and how strengthened relationship can be used to enhance our well-being and improve on health outcomes. That is my tagline. So we strengthen relationships to improve health outcomes. So we do that on different levels. So it is important for us to know what your message is. Secondly, who are your target audience? Like I just mentioned, target audience primarily are childbearing families. Childbearing families as consumers, then the healthcare workers that attend to childbearing families, they are equally my clients. Then the organizations and other stakeholders that deal with childbearing families, they are also my clients or customers. You can see that I can have products or services that is relevant to different people, whether it's the patients themselves or the organizations or the professionals. Know your message, know your target audience, and then use a medium to send your message. Many nurses are doing amazingly now. They're able to start putting it out, health content, aside selfie, the life of a nurse. These are the things we used to see before, but thankfully it is changing. I like the comment that one of us made at some point where she said collaboration. Collaboration is key. Many nurses are springing up. They want to change nursing. They want to change nursing. Be specific. What aspect of nursing do you want to change? How do you want to change it? Who is currently doing what you're doing? How can you collaborate with that person to make this thing, to make it work? Collaboration is key. So I've taken time to give us some quick nuggets on how we can become relevant in our field. I really would like for us to ask questions that would make you draw more out of me. I'm pressed for time, and that's why I just gave us that brief. Remember, appear. Wherever it is you are, look for opportunities to appear, and appear at 100%. Appear 100% in dressing, appear 100% in content, appear 100% with your words. Then secondly, you behave. Behave the part. What do you vision for yourself? Start behaving like them. Start behaving like them. Then C, communicate. Always speak. But that communication is not just opening your mouth to say something. You have to learn the science of communication. You have to learn the psychology of communication. You have to learn how to communicate. These three things are important. Where you need help, please get help. I had to get a role model from afar. I told you, Jonah Kadilo. And then within Nigeria, I started looking for people. I pretty much am self-made. And then I had to join some other programs outside of nursing to get myself developed as well. I'm not going to mention personal investments is what Melvis said, but I did that a whole lot. So you might find me anchoring, you might find me as an MC. I used to do that for free before, but that's another stream of income for me. So when I anchor events now, I've anchored for Nursing Council, I've anchored for the private nurses, I've anchored for the public nurses body, at the national level, I've anchored for other scientific programs and conferences. I don't do weddings, just in case you want to come for a wedding, except it's the Queen of England's grandchild that is wedding. Then you can call me up for that. But there are different ways that you can actually make yourself relevant. Why do I take this podium? Why do I speak on podium? It's always an opportunity to introduce myself as a nurse, for people to understand the capabilities of the professional nurse. So at this particular point, I would be very glad to welcome questions. That is how you can draw more from me. Thank you very much, Max, Walter.
My God. Okay. My God. Okay. At this point, I'm a stammerer. Okay. I'll try and calm down. I'll try and take it easy. Like, please, can you just unmute your microphones for just a few seconds? Unmute your microphones and say something.
Oh my God, this is awesome. Like,
awesome.
Hey,
God.
Like, it's more than awesome. Great section. Amazing.
Wow.
wonderful.
Thank you, Rachel. Thank you so much.
All right, you can mute your microphones. Can you mute your microphones?
Truly the powerhouse.
I salute.
You know, there's this thing. Please, can you mute your microphones? Thank you. Yeah. There's this particular I say an adage or an idiom at my place. It says if you're giving yam, you're supposed to be giving yam with sauce so that you can enjoy the yam. You understand? But in this situation right now, we look like we'll be giving yam and we don't even need sauce for it anymore because everything has just been like it's been really, really wonderful. And we really appreciate it. Like it's so nice. Yeah, thank you so much. Okay, quick one. I don't even know if they'll be having questions, but because trust me, because even the questions I wanted to ask, I was planning my own questions, but while you spoke, you were answering the questions, and I was like, oh my God, like you're totally awesome, totally fabulous. Okay, quick one, please. Oh my God, what is this?
You understand? We're in Nigeria.
Yeah, it happens. Okay, quick one, please. If you have any question, please kindly go to the comment section. Please kindly go to the comment section. Drop a question. Keep a question.
Thank you. Anoluapo, thank you so much.
Okay. Yeah.
Okay. Mike.
Yeah. Okay, let's get the question. Any question? Any questions? Please, can you ask, just please. Can you channel your questions to the comment section, please? Mute your microphones, everyone, please. Thank you. Can you mute your microphones, everyone, please?
Okay, so someone is asking me to spell the name of the American nurse, Donna Cadillo. Let me see if I can get that.
Okay.
Just mind you that I followed her for years without sending her one message.
Yeah, amazing. She's an amazing personality too. I follow her as well.
I think it was Mavis who said it, that once you have a mentor, the mentor will see as a liability. So you don't want to be that.
Right. Okay. I think okay. Obviously, I don't think anyone has any question. Maybe obviously you've answered all our questions as well.
Thank you.
Can I speak, Walter?
Oh yes, over to you, sir. Over to you. Please.
Thank you. I needed to come to specially appreciate Julie for making it to the webinar. Trust me, Julie is not one of those people that you meet and send an email and get invited to a program. I mean, while she's right here, she can tell you that our slot for July, August actually almost filled, but because of the reputation of our institution, and of course, over time, professional relationship, she had to bless us with her presence. And I can see from the comment and feedback that the participants are very, very inspired. And of course, they are ready to take the next level of their life to make the rest of their life. So, Julie, I know I didn't apologize to you. As the host, I'm supposed to anchor you, usher you, but I mean, we have a team that did that, and it was fantabulous as well. Thank you very much.
Happy you are not the one handling this yourself.
Not at all. Not at all. Thank you very much. Thank you very much. I just wanted to say hi. Thank you.
Thank you. Thank you so much, Prince. So greatly.
Okay, thank you so much, Prince. Really nice seeing your face again. You know, I know everybody was already expecting also. And someone's actually asking me a question in my DM. They would like to know, are you actually related to Prince Will in a way? Because the person is saying there's only one person they know that speaks this much without interruptions, and it looks like you're reading from somewhere, but you're just speaking, just coming out and flowing. So they want to know if you are related to Prince Will, because the last time they saw this was from Prince Will.
I started speaking professionally in 2007, but speaking for me comes naturally. I still had to go learn, and I joined myself to a platform that further groomed me and gave me the opportunity to keep harnessing my skills, keep honing my skills. So I am not related to Prince Will by blood. I'm related to him by profession and by passion and by vision.
Amazing. That's totally nice. Totally nice. Okay, sorry, can you still hear me? I don't understand what's happening on my phone right now, but can you hear me?
I can hear you very clearly.
Okay, all right, thank you. All right, okay, in the absence of any questions, okay, quick one, you're going to do something for us, okay? You're going to give us your final words. Afterwards, you give us your social media handles. Though we'll still find a way to channel it across to the group so that they can follow you. And of course, we're going to get more and more inspirational and wonderful contents from yourself. So please, over to you. Thank you.
All right. Thank you very much, everyone. I really appreciate all the love and the feedback that I'm getting from this very brief session. I want to tell you that you are your own competition. You are your own village people. There's no village people following you from anywhere. You are your own limitation. You cannot think beyond the boundary of what you have set for yourself. So you need to break away from the norm, allow yourself to think wide and far. The concepts that we developed, I am in my own corner, doing my thing, posting when I can post. Many of you, I took a break from social media. I'm just going to get back soon. But because of the work that I'm doing, I've gotten calls, my profile has been heard on this same concept. It's gonna blow the nursing profession on this same concept from the US, from Hong Kong. The last meeting I had a week ago was from Indonesia. At the time I finished the meeting with the guy, he told me, Julie, I'm a lecturer in the university, but you have the experience that I do not have. Imagine he's a lecturer. So do not limit yourself at all. So long as you have a trade, master it. And then one more thing, once you find your message, please stay on it. Once you stay on it, give yourself 3 years at the least, you become an expert in that field. I did not know until someone told me, she's now in the US, not even her alone. She said, Julie, forget it. Whenever they talk about family nursing in Nigeria, it's your name that comes up. And that's because I learned from a coach who told me, get your message, stay on it, be consistent with your message anywhere you find yourself. So like I said, you are your own competitor, you are your own village people, you are your own limitation. So tell yourself, get out of the way so I can move forward. A coach once told me that, and I'm sending that message to you. So get out of the way so you can move forward.
Okay. Your social media handles, please. Let's also have your social media handles.
Simple. You see my name as it is on my screen. Google me across all platforms. Google, my platforms will come up.
You heard that, guys. Don't just search for her on Facebook. Google her. Like, if you easy do, I'm like, hey God, if you search for me on Google now, no results found. Oh God.
I did a test. I told myself, sorry, very quickly, Max. I told myself years ago. I said, once they Google Julie, what comes up? It was It was a porn star that came up with the name Julie. And I said I was going to make that change. So once they search Julie Mogbo, what will come up? That was a question I asked myself. So there was nothing much that came up. So whatever it is you see now is what I did and stopped about three or 4 years ago, because I have taken a break from social media. So just Google Julie Mogbo. You will see things come up. My platform, across platforms, Julie Mogbo.
Okay, thank you. Thank you. Okay, I want to quickly ask a question in the comment section. If you've actually Googled her name right now, if you're following her already, kindly indicate, just say hi in the comment section right now. If you know you have, just kindly say hi in the comment section. If you done that, if you done that, all right, no problem. The absence of that, right? Oh, okay, Galaxy Note 10. Come, it's like Samsung was invited for the program too, because I'm seeing Galaxy Note 10.
What do you find?
What did you find? Can you let us know what you found, please? All right. Okay. Thank you so much. Personally, I must appreciate you on behalf of every member of the team. Like, this was a very, very wonderful session. Somebody was like, wow, imagine we didn't have you tonight. We forget bad dreams. We wouldn't have slept or eat for bad. Like, would have anyway. Since we prayed about it, there's a way we would have actually had this session in our dreams, and there's no two ways about it. This has been really wonderful. Thank you so much. Thank you so much, Julie Mogbo. We would like to connect more with you. We would like to have you more on subsequent events, subsequent programs. This has been really, really enlightening, mind-blowing, and in fact, let's just use the word supernatural. Like, it's been awesome. Thank you so much. We do appreciate it. Thank you so much for
thank you, everyone.
your beautiful presence. Oh, someone wants me to tell you that you're looking really, really beautiful. Aha, amazing, amazing, amazing. All right, then. Thank you so much. All right. Really